Evening, everyone. It's really my privilege, I can say, to introduce Dr. Meera Achrekar. She's my closest colleague, and then we are together in NABH New Standard Evolution. And Miss Meera, Dr. Meera is the professor of Homi Baba National Institute, and she's also working as the Deputy Nursing Superintendent of Achrekar Tata Memorial Center. She has 25 years of experience in various hospitals, India and abroad, education and service, worked in various capacities from assistant lecturer to chief nursing officer. She's a faculty for post-graduation program in nursing, and she's also as an examiner for BSc nursing students, MUHS and MGM University. She's a member of Board of Nursing Studies at MGM deemed university. It's again a great pleasure for me, dear Meera, to invite you to take forward the session.
Thank you so much, ma'am. I'm honored to be introduced by you. And I'm really thankful to you also for including me to be a part of this session. So this topic I'm going to take today is on personalized nursing care plan. So nursing care plans is something which all of us are familiar with. I remember as a BSc student when I was a student in my first year and we were asked to write a nursing care plan. And we used to keep thinking, kya likhna hai, what to write. You know, it was so difficult in the initial phase till our teachers brought us into focus and ensured that we were able to identify and do things correctly. So what is a nursing care plan? Just to refresh our memory, a nursing care plan is the written manifestation of the nursing process which the American Nurses Association defines as the essential core of practice of registered nurse to deliver holistic patient-focused care. And this process has 5 steps. It has assessment. That means you're going to gather all the information about the patient by doing a head-to-toe assessment. And you are not only looking at the physical parameters, you are also looking at the psychological, the social, the spiritual, environmental, all these factors you're going to assess. Second, after doing a nursing assessment, you are going to come out with a nursing diagnosis. Here we identify some issues which is there in the problem, which is going to be addressed. Then we are going to decide our outcomes. How are we? Is our goal a short-term goal? Is it a long-term goal? We are going to do planning to attain that particular intervention, to attain the goal. We are going to implement whatever we have planned. And finally, you are going to evaluate and see whether this is done or not. And we'll discuss some more in the next sessions. Now, another important thing for this topic today is personalized. Personalized nursing care plan. What is personalized? Personalized means, according to dictionary, it is designed or produced to meet someone's individual requirements. That means you are going to give more focus on the patient as a person. The NHS England has published guidance on delivering personalized care. There is evidence that personalized care planning can lead to better patient outcomes. It can reduce hospital readmission rates when inpatients are provided with individualized discharge plan rather than routine discharge care. So here also they are trying to focus how focusing on the patient as an individual brings about a better outcome. There are other studies also. There are so many studies, but I would like to highlight one of the study which was there in Cochrane Nursing Care Network. Personalized care planning leads to improvement in certain indicators of physical and psychological health status and people's capacity or capability to self-manage their condition when compared to usual care. So this also shows that when you are giving a personalized care plan, there is an improvement in the physical and psychological health status of the individual. So there are different studies which shows the importance of having personalized care. Now, care plans can either be considered a bane, like we thought when we were students, what is this? Why do we have to write it? We don't like writing it. We can come from that concept to thinking that it is an invaluable tool which will help us to focus efforts. So whatever end of the spectrum you fall on, whether you like nursing care plans or you despise them, individualized care plans are required components of many regulatory agencies. Today, NABH also is focusing on nursing care plan. So it is becoming, in the future, it will become mandate that all the hospitals will have nursing care plans. Knowing care plans are required doesn't help move the needle towards the love side of the equation. It doesn't mean that, okay, it is compulsory, so I'm going to start liking it. There are still people who may not enjoy writing a nursing care plan. So when you're looking at the care plan, we are looking at the existence. We are not looking at creating a care plan which is like a checkbox. Okay, एक core है, ये box को tick करना. You just have to tick mark, tick mark, tick mark, and you're not focusing on the intervention, considering putting the patient in focus. In addition to being a requirement, a care plan should be tailored to meet patient's specific needs and diagnosis, as well as being utilized as a guide. It can be utilized as a teaching tool or roadmap for continuity of care activities. Sounds great, right? Sure. But so far, this is just a reiteration of the fundamentals. Let's go to why it is important to personalize a care plan. When you personalize a standardized care plan, you want to keep in mind that there is a balancing act between evidence-based practices of the standard care plan and the patient's personal experience, individual needs, and perspectives. This is something we need to remember when we have followed nursing care plans for a long time. But when we are focusing on this care plan, we must keep in mind the evidence-based practices, what is relevant intervention for that patient. We also have to look at patients' personal experiences, what is their perspective, what is their individual needs. So even if the hospital requires care plan, unless it's a strict requirement, there's a good chance that nurses aren't preparing one for every single patient. It may be because they are too busy to write a care plan. They are overwhelmed with redundant paperwork. Most of the information in a nursing care plan is already present in the EMR, and nurses may not think why it is important for us to write one more paper on the care plan. Unless care plans are required, unless it is made mandate, sometimes nurses may not make them. The most important thing is, unless care plans are useful, writing them will be perceived as more busy work, the bane of every nurse's existence. Now, what are care plans? When you write a care plan, it has to have a clear set of action that enables patient and healthcare practitioner to achieve a goal in relation to a specific problem or need. So there are three things that we are looking at when we are looking at a care plan. One is the problem. It can be a need or it can be a current ability. Second is the goal. You can call it as an aim or you can call it as an objective. And third is, what is the action that you're going to do? What is the plan that you have? Or what is the intervention that you're going to carry out? Now we will see one example about this. So you can see a problem. Miss Rekha, she is having pain. She has just had a surgery. She is having pain. Her pain score is 8/10 at rest. See, the problem is very, very specific. We are saying that Miss Rekha has a problem because of a surgery and her pain score is 8/10. It is well defined. So now what is the goal? Mrs. Rekha would like to reduce her pain score from 8/10 to 4/10 in 4 days. Now look at the goal. How normally we would write pain reduced, pain minimized. This is what we write. When we are talking about personalized care plan, see how Mrs. Rekha, that means I am focusing with name of a patient. So Mrs. Rekha would like. Now, what does this mean? It is not my idea of what should happen. It is what Mrs. Rekha would like as a patient. So Miss Rekha would like to reduce her pain score from 8/10 to 4/10. Again, we are looking at a realistic goal, 4 days. We are not saying tomorrow because she has had a major surgery. She is not going to be pain-free in the next few days. Then we have listed a list of actions. Now look at the actions. Give prescribed analgesics 4 times a day. Who is going to do this? The nursing staff. It's very clear. You can even mention the nursing staff will give prescribed analgesic 4 times a day. Why is it important to write? Because today in this shift, I am going to look after the patient. The next shift, somebody else is going to look after the patient. So it is very important that we define who is going to do what. Then second, Mrs. Rekha will inform nursing staff if she requires additional analgesic for breakthrough pain. Again, now whose responsibility is this? It is Miss Rekha. So she will inform. That means she has been involved in the decision making and she agrees that she will involve if she requires additional analgesic. Now next is record pain score 4 hourly. Who is going to do this? The nursing staff is going to do this. Next, Mrs. Rekha has agreed to follow exercise regime planned by the physiotherapist. Now has agreed. That means the physiotherapist and the nurse has discussed the exercise regime with the patient and Mrs. Rekha has agreed to follow the exercise regime. So the onus falls on Mrs. Rekha. Wound will be assessed for healing or any complication. That means who is going to do it? This the nursing staff is going to do. Next, Rekha will keep her feet raised on pillows. So who has agreed to do this? The patient. Next, Rekha will inform healthcare personnel for any concerns or suggestions. Again, Rekha has been informed that if you have any issues, you need to call us. So any suggestions you also have, you have to tell us. So this is how an individualized nursing care plan will look. Now, we have not yet started this in our hospital. In Western countries, you will find that all plans discussed and agreed by Mrs. So-and-so. And she also will sign because she says that, okay, this is for me and I also agree to what you are saying and I will get this sign. Plus the sign of the nurse who has prepared the nursing care plan. So when you're looking at a care plan, it should be smart, it should be personalized, it should be collaborative, it should be concise, it should be legible. So we will just look at few things what this means. Personalized, that means involve patient in decision-making process. How can the patient contribute towards his or her care? You can ask them, what is it, how would you like to? How many days do you want the pain to reduce? Within how many days do you think you can walk a particular distance? So this is how the patient's input is also taken. Next important thing is what decisions can he or she make? Now autonomy has to be given to the patient. They can decide. This decision will be taken by the healthcare personnel or the patient's relative only if the patient's decision making process is challenged. Otherwise, the patient should be involved in the decision making. Ensuring where appropriate that patient takes ownership of his or her care plan. Like we saw what Rekha has done, she agrees to, that means she's taking ownership for her care. So this means it's a personalized nursing care plan. Second is collaborative. Nursing care is never on its own. We have different disciplines who is looking after the patient. We also have the family who is looking after. So who else is contributing towards achieving the goal? Like we saw about Miss Rekha, who is the other person who is involved? The physiotherapist. So we are having a collaborative approach. Everybody's input is required to ensure that patient achieves their goal. Then third is concise and legible. You don't have to write stories in your care plan. It has to be to the point, no ambiguity. When you say that the patient's pain score should be from 8 to 4, it is very, very clear. If you say patient's pain is minimized, that means there is ambiguity. So it has to be very, very clear. Team members should be able to coordinate the care exactly as planned. If I am the nurse on duty and I have made a care plan, all the others in the team from one shift to the other should be able to coordinate the care that I have planned. Plan should be legible when I am writing. It has to be clear, neat. Everybody should be able to read it. Do not use unacceptable abbreviations. Abbreviation should be something which everybody knows about this abbreviation and not something which I think I should use in a care plan. Then SMART. That means specific, measurable, achievable, relevant, and within a time frame. The specific means to the point. Spell it out. What is it that you want? Like I mentioned earlier, the patient walks for 2 kilometers or 2 meters. So I am being very, very specific. Measurable, for example, a pain score from 8 by 10 to 4 by 10 or saturation from 94 to 98. Spirometry, today she is doing at 100, tomorrow 1000, tomorrow she'll be doing it at 4000 or 5000. Or walking without assistance for a particular distance. So all these are very measurable elements which you are going to write in your nursing care plan. Next is achievable. Is the goal realistic? Like I mentioned earlier, if a patient who has had a surgery a feet surgery or a TKR surgery, if I say that the patient is going to walk 4 meters, it is not realistic. So I have to set realistic goals. It should be relevant. Problem should be in context and relevant to the patient, not something that I think that the patient has. Goal should be relevant to the problem and action should be relevant to the goal. And the last one is time frame. We have to have a realistic time frame. The patient is going to achieve, or Mrs. Rekha or Shailesh or whoever is going to achieve this particular goal in so many days. So then it comes very, very clear, so that if I have to check out whether it is achieved or not, I know the time frame that I should be looking at. So why do we need to write care plans? Because they are focus of care. It helps in continuity of care. We are able to monitor the progress of the patient. There is a lot of communication which is involved with the patient, with the family, with other team members. We are able to give timely referrals, and because it is documented, there is a legal document to show the care that has been planned and provided. Now, care planning is as a part of an assessment tool. We know this: assess, set goals, plan care, initiate the plan, review and reflect and evaluate. In short, it is aspire. If you remember this, you will know what are the different points that we need to look at. So assess is clinical assessment. This we normally do. We look at the patient, we do a head-to-toe assessment, and we write what are the different areas that needs attention. But we also need to listen to the patient and identify what the patient can do. You also need to look at their ability before they could fall ill. Patient will tell you, I could do this, I think I can do this. Establish patient family expectation of care. You also identify physical, social, psychological, spiritual, all environmental, all needs which are there, you will make an assessment about. Once you finish the assessment, you will set the goals. The goal should be what's important to the patient. It's not what is important to me. It is what is important to the patient, what the patient wants to achieve, and together we will work for achieving a achievable goal. So this is the patient autonomy is given a lot of focus. And when we do this, we are saying we are individualizing the nursing care plan. Then the plan of care. What needs to happen to achieve the goal? That is the plan of care that you are going to write. For example, we will see this again. Mrs. Lal, she has lost a lot of weight, and she has said that this may be because of nausea. This shows that the patient is also involved when you are writing your nursing care plan. So what is the goal? Mrs. Lal would like to regain some lost weight and enjoy her food. When we write from our perspective, we may just write she should gain weight by 2 kilos. But here you see, because a patient has been asked, she wants to enjoy her food. So the goal becomes she gains some weight also and she enjoys her food also. And the aim is to gain 2 kg in 4 weeks. And then based on that, you have different assessments. So now here, who is collaborating? You're collaborating with the doctor for assessment and investigation. You're collaborating with the nutritionist and reviewing weekly. You are collaborating with the patient because she is supposed to maintain a food diary. You are collaborating with the family member because the daughter has agreed to bring home food from the patient, from the home. And the nursing staff, most important, some of the interventions which the nursing staff is going to do. This is also an individualized nursing care plan. Now look at this. This is how we normally find a nursing care plan. I go to different hospitals. I find most of the common problem that they write is anxiety. And they write, we will give psychological support to the patient. It's a very ambiguous statement. We need to clearly define what we are going to do. Now look at this particular slide. What is the problem? Mobility. What is the goal? To be independently mobile. What is the action? Refer to physiotherapist, monitor vitals, provide assistance with P care. Now P care again is an abbreviation which may not be very common. So if you want to write personal care, you need to write the full form or use only acceptable abbreviations. So now look at this particular, the same thing that we have written over here, we are going to write over here. Shailesh is also not able to walk and he says that he has lost confidence because of a recent fall that he had. So what is the goal? Shailesh would like to regain his confidence and walk 5 to 6 meters with the aid of his stick. It is not that he will walk independently. He will walk independently, but with the aid of a stick. And this is what Sailesh has agreed to. Again, you have the action plan. So everywhere you will see this all plan has been discussed and agreed by Sailesh. If you can do that, it will be nice, because it shows that the patient is also accountable for whatever you have documented after discussion with the patient. Then the next part is initiate. Once you have planned, you are going to initiate the plan. Then you are going to review and reflect. Was the goal achieved? Was it partially achieved? Was it not achieved? Reflect with the patient. Why was it not achieved or partially achieved? Talk to the physician, talk to your colleagues. What worked? What was the things in your plan that worked? What didn't work? And why did it not work? And based on that, now you will set new goals or update the current care plan. And then you will evaluate. The final is the evaluation. It doesn't matter how many columns you have in your nursing process. You can have 3 columns, you can have 4 columns, but you need to include all these aspects. But final documentation should be there in your nurse's notes. Your nurse's notes will have a detailed description of the action that you have taken for the patient. So you will document any variant in actions, the problems that you faced, what progress the patient has made, was there any omission, was there any change in decision, was there any referrals, was there some conversation and communication with other healthcare personnel. All those things has to be documented in the nurse's notes. So very important is you need to be self-aware, show care and empathy. You need to listen and involve the patient in discussion. So active listening is important. You need to build rapport. You need to identify any communication barriers you have because of which you are not able to communicate, or because your care plan is not becoming functional. You should be non-judgmental. The patient can make their own decisions. Our duty is to facilitate and support. Sometimes you may have to be assertive. For example, if a patient is having a breast surgery and she needs to move her hand, and she needs to move her hand 100 times in a day, and she says, I can't do it, there you may have to be little assertive and say that this is important. Explain why it is important that she practices this particular exercise 100 times a day. So sometimes you may have to be a little assertive. So in conclusion, I would like to say, write a personalized care plan. A personalized care plan that is meaningful to the patient will result in better outcomes. That means something to the patient, will keep the person engaged throughout the process, because now they can connect with what is important to them in the healthcare intervention. Involve patient in decision-making process and refer them with name, not as patient, or not writing just a word about them. State goals with names. For example, Mrs. Lard would like to or need support to, rather than we normally write an objective to be able to. We start with that and not with the name. The moment you write the name, the ownership shifts from the nurse to the patient. And write one problem and a goal. Don't mix up too many problems and too many goals. I would like to give an example of a personalized thing. I went to one of the Taj Vivanta hotel. And there, every time you go to a hotel, you find a kit which is kept over there. It's a routine thing in most of the hospitals. But in Taj Vivanta, there was a kit which was tied in a nice satin bag, a potli, and there was a personalized message which was kept with the name written on it. I still remember it because it was a personalized message which was given by the hospital management. That is why it is important that you give personalized attention to the patient. So even if you are able to make a difference in one patient, I think we make a difference. We make a whole lot of difference. At the end of the day, I can truly say I made a difference in someone's life today, and that is why I am a nurse. Thank you so much. I thank Kaho for giving me this opportunity to make my presentation and present my point of view for today. Thank you so much.
Thank you, Dr. Meera. It was awesome to tell you. You have presented so well. I think every viewer understood. And now they will go back and they will say that the routine generalized nursing care is no more valued. The personalized care, because when we go for assessment also, we always comment that all generalized nursing care is being given. But personalized, and you have emphasized on the involvement of the patient in the care. That was another one of the most important thing. And you said when we are setting up the goals, it has to be smart. So that also you have emphasized. And you said it reduced readmission. You also said it's a roadmap of continual care. I can't say anything more. Meera, it was great. It was awesome. Thank you so much. Yes, especially for accepting our invitation and being present over here. Thank you so much.